I'm about to talk to someone that has a really unique vantage point of being both a practicing clinician, but also a medtech provider. Dr. Jeff Hersh is the Global Chief Medical Officer for GE Healthcare, and I'm going to ask him about his experience of addressing medical crisis throughout his career and how that applies to this pandemic, but also what he thinks daily life and medical technology will look like post-COVID-19. Give me a little bit of information on your background and what you're currently doing and how you got to where we are today.
So my job for GE, I'm the Chief Medical Officer globally. And so my role there is giving medical support to all the facets of the company. That's one of the hats that I wear, a little bit germane to this discussion. I'm also the Chief Medical Officer of one of the United States federal government's disaster medical assist teams. And so I work for the federal government under Health and Human Services. I'm on call every 3 months. And when there's need, the United States government can call me and my team, of course, and we respond to medical disasters. I was the chief medical officer for my team responding to the earthquake in Haiti. I've responded to multiple hurricanes, floods, all kinds of different things. And most recently, in March, I was deployed to respond to the COVID-19 crisis by caring for patients who were in the Air Force Reserve Base down in Georgia in the United States and who were under quarantine because of exposure to the COVID-19 virus.
How are you balancing sort of the CMO for a major corporate versus a practicing clinician? How do you balance those two and still have a family life?
So most of my time I dedicate to GE. We do as a company a tremendous amount of good. When I see a patient one-on-one, if things go well, I can help that individual patient. When we as a company develop a new product, if things go well, the potential is that that product can benefit tens, hundreds of thousands, millions of people. And so the potential impact that we have in the work that we do at GE is amazing.
When I started this journey, states were closing down. Florida's now opening up. What does life look like after COVID-19? What are the societal norms that existed before COVID-19? How are they going to change? Are they going to change?
Until there's a very efficacious vaccine and we actually can get the infectivity and the contagious aspect of this significantly under control, we will continue to have some semblance of recommendations of social distancing, wearing masks. We all should continue to wash our hands. And unfortunately, if we see a flare-up of this in the fall and the winter coming up, when we know the flu will be going around as well, the potential for that nightmare scenario is huge.
Do you feel like there's going to be a new landscape, a new surge in demand for particular instruments and systems post-COVID-19 as opposed to what customers were looking at prior to the virus?
I think there will be a change. I think a lot of medical care, or a lot more medical care now, has been done with virtual medical care than was before. And that may be a good thing that has come out of this whole crisis, because now people realize the need, hey, I'm going to go see my clinician, but I'm going to do it virtually. Just like right now, you and I are not doing a face-to-face interview, we're doing a virtual interview. And that's become more and more accepted. There's also a need to have more point-of-care healthcare. And that might include point-of-care ultrasound. That might include point-of-care monitoring. For example, there's a program right now at Brigham and Women's here in Massachusetts where they admit patients from the emergency room, and every nth patient who's admitted is admitted to the hospital, but their house is their hospital. And so they're admitted to their home, but they're admitted. And then they're cared for, but they're cared for in their own home. And there are benefits for that, because nosocomial, that is hospital-acquired infections, are not going to be as prevalent in your home because it's your home. And so there are potential benefits. Now, there are also potential challenges there, because you don't have all the medical equipment right there all the time, and you may not have all the human resources right there. And so working through those, which patients can that be done with? How can you do it in a way that gives them still excellence of healthcare. And so we're going to learn quite a bit, and maybe this whole COVID-19 crisis has sped that learning curve up. I hope it has.
When you look back in 5-10 years' time at this moment in our lives, what will be the single thing that stands out?
Unfortunately, the number of people who are infected, the number of people whose lives have been negatively impacted. Each life lost affects not just the human being who's died, but all the people who love them, all the people who are, part of their circle, as well as all the potential things they could have done. And so huge, huge impact. What are we up to? 200,000, more north of that, deaths worldwide. Those are 200,000 souls who potentially could have made huge contributions and who are missed and mourned by people who love them.
Brilliant insights and wonderful to talk. Thanks very much for your time.